All right, so today we're diving into something pretty important. It's a health concern, and it's hitting close to home, especially if anyone listening has visited Plymouth hospitals recently.
Oh, yeah.
Yeah, we're talking about a surge in scabies cases.
Scabies.
Yeah,
Huh. I thought that was just like a thing of the past.
right. It sounds like something you'd read in a history book, but it's making a comeback, and it's a serious one. Our sources from Dartmouth today are reporting a jump from 15 cases to 60 cases in just 1 year.
Wow.
Just in Plymouth Hospital's accident and emergency department alone. That's a fourfold increase.
That's huge.
Yeah, and get this.
Yeah.
It's not just a Plymouth thing.
Right.
It's actually part of this much larger trend happening across England. Scabies diagnoses are up by 66% nationally.
That's wild. We're also seeing, this resurgence in other preventable diseases like measles and whooping cough have been popping up more.
It's true. It makes you wonder what's going on.
It really does.
Imagine going to the ER for a routine checkup and you end up leaving with scabies. Like it's not the souvenir you're hoping for.
Right. Not exactly.
So what's fueling this unexpected comeback?
Well, reports were pointing to a couple of significant factors. There's a concerning link between this rise in these illnesses
Yeah.
and poverty and declining vaccination rates.
Okay, so let's break this down. So poverty impacting health.
Right.
That's not exactly news, but
Yeah.
the details, I think, are where things get really interesting. We have Gwen Nightingale, who's an expert from the Health Foundation,
Okay.
and she paints a really clear picture. She says that poverty doesn't just make illness more likely, it actually creates this perfect breeding ground for it to flourish.
Yeah. It's a multifaceted problem.
Great.
Think about it. If you can't afford decent housing, you're more likely to end up in damp, cold homes. And those are basically havens for all sorts of nasty bugs and illnesses.
And don't even get me started on, like, the cost of healthy food these days.
Oh, I know.
Like, fresh fruits and vegetables are basically a luxury for families who are struggling to make ends meet. And that lack of nutrition obviously weakens your immune system. It makes you more susceptible to diseases, just like scabies.
And it's not even just that, right? There's the constant stress of living in poverty.
Yeah.
It's like having this weight on your shoulders 24/7. And over time, that really takes a toll on your immune system, makes you more susceptible to, well, everything.
Yeah, it's not just a lack of resources, you're right. It's like this domino effect. Poverty really does impact a person's overall health and well-being.
Absolutely.
And speaking of intertwined things, let's talk about vaccinations.
Okay.
The reports that we have use this interesting phrase. They call measles this canary in the coal mine. What do they mean by that?
Oh, that's a powerful analogy. Basically, what they're saying is that declining vaccination rates aren't just about one disease. It's often an early warning sign of broader health issues within a community.
So could these falling vaccination rates be playing a role in this scabies surge too?
That's a great question. And while our reports don't draw a direct connection between the Plymouth scabies cases and vaccination rates, it's still a crucial part of this bigger conversation. We have to remember, this isn't just about measles. We're seeing these declining vaccination rates for a lot of things. And that weakens what's called herd immunity.
Herd immunity.
Yeah. Have you heard of that?
Yeah, I mean, I know what it is, but just for our listeners who might not.
Sure. So herd immunity basically means that when enough people are vaccinated, it creates kind of like a safety net. It protects those who are more vulnerable.
Like people who can't get vaccinated for various reasons, like infants who are too young, or maybe people who have compromised immune systems.
Exactly.
So they really rely on everyone else.
Yes, their health is reliant upon the collective immunity of those around them. So when those vaccination rates drop, those vulnerable populations, they face a much higher risk.
Yeah, that makes a lot of sense.
So while the connection between vaccinations and the Plymouth scabies cases isn't explicitly made in these reports, it's still definitely something to be aware of, so as part of this larger trend.
It sounds honestly kind of bleak, to be honest. But I mean, these reports don't just leave us hanging, right? There's got to be something we can do to combat this.
Oh, absolutely.
What can people do?
Knowledge is power. And, even small actions, they can create a ripple effect.
So give us the action plan. What can our listener do today to make a difference?
First and foremost, check your vaccination records.
Okay.
And it's not just for the kids either. Adults need boosters too.
It's easy to forget.
It really is. It's easy to forget with everything else going on.
Yeah, life gets in the way.
Exactly.
Yeah, it's true. Those vaccination appointments really sneak up on you.
They do.
So if you're unsure about anything or if you have questions, your GP is there to help.
Absolutely. Reach out to them. They'd much rather, answer your questions. than have you worrying unnecessarily about things.
For sure. And it's not just about, our individual health either, right? What else can our listeners do?
But we can all become advocates for better public health measures.
Okay, so what does that look like in action?
Um, well, it can take many forms. You can support policies that address poverty. You can push for improved access to health care. And you can speak up about the importance of vaccination.
Yeah.
These aren't isolated issues. You know what I mean? They're all interconnected. And tackling them, that requires a collective effort.
That's so true. It's like we're all part of this massive web of well-being.
Exactly. And I think that's what makes this deep dive so important. It's not just about like a scabies surge in Plymouth. It's about understanding the complex interplay of, health, poverty, and public policy.
Right.
It's about recognizing those connections and then using that knowledge to actually drive meaningful change.
So as we wrap up this deep dive, I'm left with this thought-provoking question for our listeners. Could this surge in these preventable diseases be a symptom of something larger at play within our society?
Something to think about.
It really is.
And that's the beauty of a deep dive like this. It's not about giving you all the answers, but it's about providing you with the knowledge and the tools to start asking the right questions.
Yeah.
And hopefully to start finding some answers of your own.
Knowledge is power, right?
It really is.
So to our amazing listeners, thank you so much for diving deep with us today. We hope this episode has empowered you to prioritize your health, to engage in these critical conversations, and to advocate for a healthier future for yourself and for your community.
We're all in this together.
And until next time, stay curious, stay informed, and stay healthy.